Welcome to this abbreviated Vapotherm training video. This video applies only to the Precision Flow Plus and Precision Flow Hi-VNI units. It refers only to non-preassembled DPCs. If your hospital uses preassembled DPCs, please disregard that portion of the training. For more detail, please consult the instructions for use and watch the full in-service video. For more information, visit www.vapotherm.com.
We will now demonstrate how to set up the disposable patient circuit. Both disposables allow for 30-day, single-patient continuous use before required replacement is needed. In each DPC package, you will find three components: the disposable water path, the vapor transfer cartridge, also known as the VTC, and finally, the patient delivery tube. Use the following steps to set up the DPC. Remove the vapor transfer cartridge from its individual package and remove the 4 rubber covers from the pegs. While holding the disposable water chamber by the handle, line up the 4 pegs of the vapor transfer cartridge to the 4 holes in the chamber and insert the cartridge by pushing it firmly into place. It does not matter which way the cartridge is oriented. Next, remove the patient delivery tube from the packaging and locate the 3-pronged attachment at one end. Still holding the disposable water path, flip it over and locate the 2 holes and port on the side of the chamber. You will note that similar to a puzzle piece, it will only go in one way. Line up the pronged attachment on the delivery tube with the corresponding holes and port in the disposable water path and push into place. Still holding the disposable chamber by the handle and using your free hand, open the door to the Precision Flow Hi-VNI docking station. Coming down over the top, smoothly and quickly slide the disposable circuit into place, making sure the heater plates are lined up, and push firmly down so the DPC is flush with the bottom. This ensures that the magnet in the DPC is fully seated into the metal cup in the docking station, allowing the water to be properly pumped and circulated. When you are finished, shut the door. Using aseptic technique, remove the cap from the spike, rub the tip with an alcohol wipe, and then spike your sterile water bag. This is very important. Before we turn on the unit, we want to unclamp the water inlet tube and make sure 200 milliliters of water is flowing into the disposable patient circuit. Wait approximately 90 seconds before pressing the Run Standby button. If you are using a hard water bottle with our spike adapter, wait 180 seconds. Connect your air and oxygen hoses to your gas source before you turn on the device. We like to think of this as gas before go. Once the air and oxygen are connected, plug the power cord into a facility-approved outlet. Please ensure the clip is in the lock position over the cord to prevent the unit from coming unplugged. When we look at the front of the unit, you will notice that there are 3 controls: the Run Standby button, which starts the unit and places it in standby, the Setting Control knob, which allows you to adjust the parameters, and the Alarm Mute button, which allows you to intermittently silence alarms and also dims the display panel. Here you will notice that the screen is blank. That is because there are 3 modes to the unit. Those are Sleep, Standby, and Run. In Sleep mode, the unit will have a blank screen and an amber light showing. The unit cannot be started from Sleep mode. To put the unit in standby, simply rotate the blue control setting knob to illuminate the display. You will see the 3 parameters of flow, FiO2, and temperature. You will see that the parameters are flashing and are shown with zeros, indicating that no flow is being delivered to the patient while in standby. You will also see the corresponding cartridge indicator on the lower right-hand side, which will identify what type of disposable patient circuit is in place: a blue icon indicating high, or a red icon indicating low. To enter Run mode with the screen illuminated, simply press and release the Run Standby button. The machine will give a series of 10 beeps and will begin to power up. During this self-test, the DWP icon is illuminated. At this point, the small light above the Run Standby button will change from amber to flashing green. Let's focus on the light indicator above the Run Standby button for a minute. When the light indicator is a constant amber, that means the unit is in standby and there is no flow being delivered. When the light changes to a flashing green, the unit is in Run mode and there is flow being delivered, but the unit has not yet reached the set temperature. When the light is a constant green, the unit is in Run mode and the flow is being delivered with all parameters met. To adjust these parameters, do the following. Push the center blue control knob and the FiO2 flashes. Turn the knob to your desired setting. Push the center blue knob until the temperature field flashes. Then turn the knob to your desired settings. Push the center blue knob until the flow field flashes. Then turn the knob to your desired settings. The settings will always toggle in a clockwise manner, starting with FiO2 first, temperature second, and flow third. Once the selected parameters have been set, simply stop pressing the button. The setting will blink 5 times and the unit will lock it in. Now we are ready to select our cannula. It is important to select a cannula that does not occlude over 50% of the inner diameter of the patient's nares. Once the proper cannula has been selected and the set temperature has been reached, you may place the cannula on the end of the delivery tube. Now the setup and patient placement is complete.
It is always recommended to use appropriate personal protective equipment when treating patients. Compared to other ventilatory modalities, the risk of COVID-19 transmission when using Vapotherm high-velocity therapy is low. You may reduce risk even further by placing a surgical mask on your patient. To do this, first place the cannula on your patient. Then, place the surgical mask on your patient. Ensure that the mask fits well and leaks are minimized. Then, turn on the therapy.
Once the unit is set up and running on a patient, the unit should not be placed in standby mode for extended periods of time. If you need to pause therapy for the patient, please remove the cannula from the patient, turn the parameters to the lowest settings, and leave the unit running. Please remember that the only time the unit should be put into standby mode is when the patient is completely done using the therapy and you're taking it out of their room. Once the therapy has been discontinued, we can remove it from the patient and prepare for the next patient. To do that, follow these steps. Remove the cannula from the patient. Place the unit in standby by pushing and holding the Run Standby button for 2 seconds. Clamp the water spike. Discard the entire disposable patient circuit, from the cannula to the sterile water bag. Yes, this includes the water supply. Throw it away.
The DPC and water supply should be discarded in a biohazard bag. Using a Super Santa cloth, a 70% IPA solution, or another approved cleaning solution, wipe down the internal docking station as well as the precision flow unit. You have now cleaned the device and are ready for the next patient. For additional trainings, as well as free CEU credits, please visit Vapotherm Academy at academy.vapotherm.com. Thank you.